Center in Mumbai and has been associated with auditory verbal training and giving colleagues and teaching cochlear implant to children. An overview.
Good afternoon, friends. I'm presenting role of therapy post-implantation. The universe is full of magical things, patiently waiting for our bits to grow. These words of Eden Philpott seem to be prophetic, because for decades, the inner ear or the cochlea was considered to be a no man's land. But this miraculous device called the cochlear implant has exploded this myth, because every profoundly deaf child today is back into the world of sound and can achieve a foundation in spoken language. Then the question naturally arises, why do we need therapy if it's such a miraculous device? One must remember that the cochlear implant is only a prosthetic device. It does not replicate the normal functioning inner ear. And getting a new cochlear implant is like getting a new car without the keys. So therapy is vital because in the beginning, when the switch on takes place, the child is bombarded with an array of sounds. He learns to listen to environmental sounds, speech sounds. He has to learn to identify them. He has to learn to associate meaning to the sound, and slowly to words and then to sentences. Quite naturally, the auditory verbal technique is the most ideal method because it focuses entirely on listening, and it is through this power of listening that the child aggressively develops speech and language. And the maximum benefit of the implant is got only through listening. Now, the auditory verbal session is individualized, tailor-made to suit each child, following a hierarchy of listening skills, giving great attention to audition, cognition, speech, and language. Empowering the parent. So, if you compare the device to a car, then it's very important to know that the driver of the car is the parent and not the therapist, and we are just guides by the side. During the session, the parent actively participates, gives models of key language structures, and the therapist educates the parent about the stages of normal language development. That is the goal. There are a lot of technical terms involved in auditory verbal therapy which need to be explained to the parent, like, for example, expansion. Now, suppose the child just says a single word, the therapist must teach the parent to expand it into a whole utterance. Then there is generalization. Say the verb cut. The child must know that you cut paper, you cut nails, you cut hair, you cut cloth. So ideas for carryover at home are discussed in the therapy session in a very informal manner. So however, the ultimate goal is to get an empowered, confident and independent parent. Now in this video, which is an old video, but because this child today is now speaking in 2 languages, but you will see now that the mother is trying to actively participate. She's not very good in English, but there are certain technical terms such as acoustic highlighting are explained in this.
Now I've got a boat. You like boats? You like boats? Mommy, do you like boats?
Yes, I like boats.
Row your boat gently down the stream. Merry, merry, merry. Life is but a game. Take the boat. That's a boat.
And the boat.
It's an orange boat. Want to put the boat into the water? In the water. Put it in the water. Now, Mama, listen. Give me the fish and the duck. Give me the fish and the duck, please. Listen again. You give me the fish and the duck. Give me both. Give me both. Yes. And the. Mommy, you listen. Give me the fish and the duck. You want fish and the duck.
You understand?
Now
listen. Now it's your turn.
Listen.
Your turn. I want the boat and the frog. Listen, Mama. I want the boat and the frog.
Like yes.
And the boat.
Good boy. Good boy.
They're all wet. Mommy, I was noticing that you were not using two sentences.
మన MBBS
It's
ఉంది
really
అసలు
important for you to use all the vocabulary in full sentences because then it becomes more meaningful. And what you put in, you will bring it out. So it's extremely important for you to speak in full sentences. Now you did notice that we were doing two item selections. Now you need to know that this two item selection what I did here is extremely artificial and you need to carry it over at home. Could you think of some ideas which you could do at home?
Shall I tell him go and bring your shoes and the ball
Very good.
and go to the kitchen and bring plates and glass?
And when you go out, ask him to point out to the car or the bus. Tell your life. And lastly, I was very pleased to see you begun to do acoustic highlighting, but you should do much more of it with a focus on the key word that you wanted to hear. For example, we are teaching him color, so you want him to hear yellow. You say, that's a yellow, that's all. You lean forward towards him. Otherwise, you did a good job. Praising the parent is an extremely important part of our therapy. Diagnostic evaluation, Geeti has spoken a lot about that, but it's an ongoing process, psychologically harmful for the mother to be testing the child. So it's done on a regular basis during every session. The objective, of course, is to reach normal standard scores. Every session helps us to know what to plan for the next session. Expectations of parents are generally sometimes too low, as in they're very happy that the child is only speaking in a single word. Or sometimes it's too high and unrealistic that as soon as they're implanted, they want the child to speak, and sometimes speak in sentences in a hurry. Now the older child is a different proposition altogether. Generally a remedial model, a lot depends on the pre-implant period. If the child has been using a hearing aid and been using his residual hearing through listening only, then the transition to implant is very smooth. But if he has been using vision and hardly had any residual hearing earlier, then other alternate approaches may have to be used, such as oral. But however intensive therapy is required, patience really helps. Many children surprise us, even when they come older, they do very well. The goal, of course, is the same, to reach normal standards. Now this child was profoundly deaf and for 4 years only lip-read Hindi and just could not say anything much. And after the implant they shifted to English. And today, I can assure you, she talks much more than this. Please, we are going to play a game now, okay? It's called Go Fish. Go Fish. I'm shuffling the cards and I'm going to deal them. I'm going to deal 5 cards each. 1, 2, 3, 4, 5. Now take your cards. You know what these are? Pictures of sea animals. Now if you've got a pair, put them down. I have a pair of lobsters. Mommy, do you have a pair? Do you have a pair, Mommy? Yes, I have a pair. You put it down. Okay. Do you have a pair, Kiti?
Yes.
Put it down.
Down.
What is it? A pair of crabs. Now, Kiti, do you have an octopus? Say goldfish. Say goldfish. I didn't get the pen. Now it's your turn. Ask Mommy. Do you have no starfish? You already have a pen. Put it down. Now ask Mommy. Do you have a crab? I don't have.
Please, okay.
So this child today speaks in full sentences, and the other day after the Ganpati festival, she told her mother, "Ma, please don't immerse the Ganpati, I feel very sad." Of course, there's a lot of grammatical mistake many a time, but sometimes she comes out with sentences like this and makes us very happy. Teamwork. Therapy does not involve only the therapist and the mother. The partnership between the audiologist and the therapist is vital, because the therapist gives the information to the audiologist about the listening patterns of the child, and this is really very helpful for mapping. There are multiple disabilities. In that case, intervention of other professionals, such as if there is a physical disability, you may need a physiotherapist. If there is a hyperactivity, you may need an occupational therapist. And if they are slow learners, you can take the help of psychologists. So you do your best for the child, you use everybody possible and work as a team and try to get as successful as possible. Finally, as a culmination of all the efforts, the child learns how to speak, is integrated into the normal school, is marching towards independence, has achieved effective communication skills, converses with his normal peers, learns to self-advocate for himself, makes informed choices, and develops a high level of confidence. In this video, this boy was very profoundly deaf and could only say a few sounds. Now today he speaks what is called English, because it's obvious that he's only listening to more Hindi and Gujarati at home. So I'm constantly correcting his grammar, but you can make out he's listening because the accent is very English.
Did you hear about the riot studies? See, what's happening here?
They're burning the train.
They're burning the trains. Oh my
They're
God.
burning the train.
But why are they doing it? Mommy, why?
Because somebody broke the statue of Dr. Ambedkar.
Is that a good thing to do? Very bad. Very bad. That's not
There's no auto in the family.
No auto rickshaws in Thane.
No.
Nembudu and Delhi, no, is not auto.
No autos anywhere. So much violence.
Windows are just like a very strange stone inside.
They're throwing stones.
I just the window now. There's somebody doing the stone. Then it found the guys are in the attack.
You heard the sound of it.
Yeah.
Be dangerous. Be careful, okay? Be careful. When does this happen? When?
On the hill.
So one of the problems we face is choosing the right language, and this is a perpetual problem because they all want to put their kids into English medium school, and then mothers have very limited knowledge of English, and the child learns wrong grammatical structures, but many of them turn out to be bilingual also, but then finally the medium of instruction is extremely important. So we are proud to be part of a program, sorry I got it through, that no longer waits to see what happens, but instead does its best to make things happen. Any questions?